Hi, in today's video, we are going to be talking about tracking abnormal results via actions in ECW. First of all, what is the purpose of tracking? The purpose of tracking is to ensure patient safety. The goal is to provide the best patient care, which means safety is a priority. We also want to be proactive in our patient's care, which can improve our relationship with the patients. We also need to consider risk management factors and how we can minimize any harm to our patient. Lastly, quality. Again, our goal is to provide high quality care to our patients, and that includes everything you see on the slide. In other words, doing the right thing at the right time for the right patient. Using actions in ECW. There are some benefits and limitations. The benefits include they can be uniformly created and logged within ECW, which means that anyone can view actions for the patient. Anyone can pick up an action or the assigned work. And actions can help us track communication with our patient. However, there are some limitations, which include actions don't create themselves. We have to create them. They are gentle reminders, so we have to look for them. Also, they are not part of the medical record. Do not use actions in place of telephone encounters. So when to use actions? For long-term tracking, we would use actions for things such as repeat PAPs, mammograms, or tracking a colposcopy. We can also use them for short-term tracking, such as STD, STI treatment, or test of cure. We can also use short-term actions for repeat labs. We can also use an action for like a 4-week follow-up for a child who may need the flu immunization. Creating an action in ECW. We can create actions from the patient hub. If you'll notice, there is an action drop-down arrow with two options, New Action and View Action. So from this option, we will go with New. This is a new action screen. There are mandatory fields, which we will cover in the next slide. These mandatory fields include things like subject, assigned to, the due date, and the status. If you'll notice the note to the side, we want to use the drop-down options for subjects such as abnormal PAP, colposcopy, and mammogram tracking. So let's talk about the required fields. First, the subject. Why was the action being created, or what is the problem? Assigned to. Who is the staff responsible for viewing and managing the action? The due date should be when the action will appear in ECW. And lastly, the status. We can mark as in progress or completed. Let's go through an example. PAP results for a patient come back as abnormal. The provider orders to contact the patient and review the need to return in 6 months for a repeat PAP. The staff have contacted the patient and reviewed the results. An action can be created to track that the patient has come back or will come back in 6 months. So for our mandatory fields, for subject, we could use repeat PAP needed. Assigned to is the person responsible for managing the action. The due date would be in 4 months. Although the patient needs to return in 6 months, we want to call the patient a little early so they have time to schedule an appointment in a timely manner. And lastly, the status would be marked as in progress. The action type, or what's going on. So if we are simply waiting for the patient to attend the appointment, we can mark the action type as appointment pending. If we need to remind the patient of an appointment, we can mark the action type as reminder or waiting to see if the patient has made or kept the appointment. If we are having trouble contacting our patient and need to send a letter, we can mark the action type as first, second, or even third letter sent. So how to view actions once they've been created in ECW. We can view actions a couple of different places from the DRTLA tab in the right chart panel. If you'll notice down at the very bottom, if we have any active actions for our patient, we can see them here, and we can also click and open the action. We can also view actions from the hub. Again, from the actions green drop-down arrow, we have two options, new or view actions. If we choose view actions, this is the screen that appears. If we click on an action such as this one here, the action screen will appear. From this screen, the user can update the action type, subject, assigned to, status, due date, or we can add notes to this section. The action due date. So our due date can help us manage the action and the next step in the process. When our actions are due, they will populate in the T Jelly Bean count. So for example, if we click on our T Jelly Bean, the action will not appear. We actually have to click on the letter T itself, and from the drop-down menu, choose Actions. The Review and Manage Action screen will appear. This will show which actions are due. If we click on the action due, again, the action screen will appear, and from here, the user can update anything that's needed. Action type, subject, assigned to, status, due date, or simply add notes. Provider instructions from the lab screen. If the provider has instructions in the notes for the nursing staff, for example, this patient needs to return in 6 months, then the nursing staff can automatically create an action to track the abnormal result. So items to be tracked automatically would be a colposcopy, a repeat PAP, and a repeat mammogram. Also, any notes from the lab screen can be copied into a telephone encounter. They can be copied into an action. A special note on colposcopies. If a patient is referred for a colposcopy and no-shows, the front office at the specialist will create a telephone encounter for the no-show. They will attempt to contact the patient at least 3 times on 3 different days. They will send a letter if we are unable to contact the patient by phone. If the patient still has not responded within 30 days, we will simply close the encounter. But regardless of the outcome, the front office should notify the referring office that the patient has no-showed. It is possible that there will be 2 actions in ECW for the same patient. One action being tracked by the primary care provider and another action being tracked by the specialist. Also, please remember that actions are long-term. It is possible that you may have an action that is 1 or possibly 2 years old. In summary, actions can help us provide the best care to our patients. They can be created, viewed, and managed within ECW. They can also be tracked, which can help us with communication. They also allow anyone to pick up the action as needed for the patient. As always, if you have any questions, don't hesitate to contact the training team. Thank you.